name is Laura Campbell and I'm an Impact Accelerator Unit Knowledge Broker at Keele University School of Medicine. My role involves connecting with and working alongside clinicians, academics and patients to take knowledge developed through high quality research into clinical practice and policy. And I'm going to talk to you today about a joint project between Rhesus Arthritis, the CSP, the NIHR Centre for Engagement and Dissemination, members of the public and the Impact Accelerator Unit. This here is the NIHR Moving Forward Themed Review, published in July 2018. Its aim was to promote an overview of research focusing on physiotherapy for musculoskeletal health and well-being. The research featured in Moving Forward clearly showed that early access to physiotherapy services, exercise, activity and self-management advice can really improve patient outcomes, reduce healthcare costs and reduce the need for further investigation and treatment. So the review is full of information which our patients and public group told us they would find useful in understanding their care. However, the full version is really complex. It's 64 pages long and includes over 50 studies, and our patient and public group told us it was not understandable or engaging. So we set about to co-produce with them a shorter, more accessible version. We wanted this version to answer patient questions like, why am I receiving this treatment and how will it help me? What does research mean for me and my care? Where can I access physiotherapy? And how can I find out more about research and get involved? We really wanted to empower physiotherapists and patients to work together to improve their quality of life and manage their MSK conditions using best evidence. The work was part of a larger community of practice tasked with implementing research and the review into local care pathways. We worked in a small group to prioritise the evidence most relevant to patients, rewrite these important messages in succinct and plain language, add diagrams, infographics and images, and develop patient stories to show research in clinical context. The draft version was further commented on by patients in general practice, the CSP research team, and the NIHR Dissemination Centre team, including a patient and public representative and the research physiotherapist who wrote the original themed review. And this here on the right is the final easy read guide, created over a period of 12 months, and it's cut down to 24 pages with lots of images. And the guide was launched nationally on the 1st of October 2020 in both PDF and accessible online versions for people using assistive technologies, for example, screen readers. Following its launch, the public version had 591 page views. In the same time period, the full-length review had 75. There was a successful social media campaign, and a news story was emailed to CSP members in the weekly CSP e-bulletin. On the week that this was published, it was the top 25 most viewed news item with 111 page views, and it had the longest average time spent on the page of all news items that week. I'm excited to say it'll also be featured in the November edition of the CSP's Frontline magazine. And feedback so far has been really positive, with patients and professionals alike agreeing that it is easy to read and provides important information for patients. And I just wanted to highlight this quote here from Dean Phillips, who authored the original themed review. And he said it was really great to see the publication of Moving Forward on the NIHR evidence website. And he said it looked excellent, and he congratulated the team for finalising this during a pandemic. So we found that research evidence is often not communicated in an easy to understand language and format. For this document, we co-created a solution with the expertise of both the public and physiotherapists. It's been really exciting and a successful way of working across organisational and professional boundaries to support high quality care. I am a big believer that having easy access to simple, trusted information empowers both patients and physiotherapists to ask questions and to discuss care, and starts to break down these knowledge boundaries, giving everyone the same information and promoting trust in treatment. So, in summary, co-production and patient empowerment is vital to work like this. So please take a look at the full document online. Thank you.